I'm Sue Gartland. Welcome and thank you for coming to our presentation today on women's heart health. Harrington Family Health Center has been kind enough to allow us to talk about this today, especially a topic that is so close to my heart. No pun intended. We here hope that we're opening the door to superior quality health care in Washington County. We'll provide integrated health care, looking at the whole person, not just the healthcare problems. Our team of family healthcare providers, behavioral health counselors, and dental practitioners work closely together to ensure that you have a positive experience while you're here. Alrighty. So, why do we want to talk about women's heart health? It certainly is rather important. Numbers have changed. Heart disease is the #1 killer of women, causing more deaths than all cancers combined. More women than men die from heart disease. It's also the #1 causes 1 in 3 deaths in women, particularly over the age of 55. And women have different symptoms of heart disease and may not be as aggressively treated as men for their symptoms. Alrighty. When compared to men, women have as great a prevalence of heart disease, but die more frequently, at least in their older years. A higher death rate, worse outcomes from acute heart attacks, and they have different mechanisms of heart disease and different presentations and risk factors. Later onset of heart disease. As I was getting ready to do this presentation, I just happened to watch Grey's Anatomy, which I hadn't watched in years. And if anybody has seen it, it was the show where Bailey, the medical director, was having a heart attack, and she went to a different hospital. And the doctors there kept telling her, no, it's not a heart attack. No, it's not a heart attack. But she knew it was. And sure enough, she was persistent enough until she fell down on the floor, and they ended up doing surgery. And it was just kind of like, that's why I'm doing this presentation. So this is the kind of the death rate or the death trends for males and females in heart disease. And you can tell about 1984 is when this started. They started noticing that women were actually outpacing men in deaths from heart disease. The numbers have gone up and down, but women still have a greater risk for death in heart disease. It's amazing to me. Alrighty, about the heart. It beats 80 times a minute approximately, or 115,000 times a day. 42 million times in a year. In an average 70-year lifespan, that's 2.5 billion times. That amazes me. That has, Timex beat. It does take a licking and keep on ticking. But even when a person's at rest, the heart continues to work and is the hardest working muscle in the body. All right, I don't know about you, but I had that aha moment when I was a kid when I realized that the heart was not shaped as a little red Valentine. My aha moment was going to the Franklin Institute and walking through the heart. There won't be a test on this, so please don't be nervous, but the heart has 4 chambers. We've got the right side with the right atrium and right ventricle, left side with the left atrium and the left ventricle. The blood flows into the blue side of the heart, the right side, without oxygen or deoxygenated, goes down to the right ventricle, which when it squeezes and contracts, it pushes up through the pulmonary valve into the pulmonary artery and into the lungs that do an incredible job of oxygenating the blood and getting rid of waste materials, and then bringing it back through the pulmonary veins into the left atrium, the left ventricle, that when it contracts, actually sends it up through the aorta and out through the rest of the body. And this is the one that always confused me. And that's all the arteries that supply blood to the heart. And I wanted to show this slide basically because this is where the heart dies. You know, if we get clogs and clots in this area, in this part of the heart, that's when we see tissue damage. The bigger ones are the left and the right main coronary arteries, the left circumflex artery, and the left anterior descending artery, which is also known as the widowmaker. All right, if you have your popcorn, this just kind of gives you a good idea of the blood flow and how the heart works. It's just a very brief video.
About the size of your fist, the human heart is the most important muscle in the body. It can beat more than 100,000 times a day, pumping about 2,000 gallons of blood through a 60,000-mile network of vessels in the body. The human heart is made up of 4 major chambers: right atrium, right ventricle, left atrium, and left ventricle. The right side of the heart receives blood that is low in oxygen from veins all over the body. It then pumps the blood through the pulmonary arteries into the lungs where it will become reoxygenated. The left side of the heart receives this oxygen-rich blood from the lungs. Then it pumps the blood through the aorta back out to the rest of the body through a complex network of arteries, arterioles, and capillaries. While blood is circulating through the body, it delivers oxygen and nutrients to tissue through the capillaries, and at the same time picks up carbon dioxide and other waste material. The veins return the deoxygenated blood to the right atrium, and the cycle begins again. The heart has 4 valves. Each valve is like a one-way door that keeps the blood in the heart flowing in the same direction. The valves are made up of 2 or 3 small but strong flaps of tissue called leaflets. Leaflets open to allow blood to flow through the valve and close to prevent blood from flowing backward. The opening and closing of the valves is controlled by blood pressure changes within each heart chamber. The tricuspid valve is positioned in the heart's right side between the right atrium and right ventricle. The pulmonic valve separates the right ventricle from the pulmonary artery. The mitral valve is positioned in the heart's left side between the left atrium and the left ventricle. And the aortic valve separates the left ventricle from the aorta. As blood circulates through the heart, some of the blood flows into a set of much smaller blood vessels that provide blood directly to the heart. These arteries, called coronary arteries, surround or crown the heart. This separate circulatory system, called coronary circulation, keeps the heart nourished and oxygenated. The 2 main branches of the aorta that nourish the heart are the right and left main coronary arteries. Coronary artery disease, which occurs when there is a buildup of cholesterol plaque, affects the arteries of this circulatory system and causes a decrease in blood flow to the heart muscle, resulting in possible damage to the heart or a heart attack. The beating of the heart, which is its rhythm, is regulated by electrical impulses generated by your heart muscle. These impulses begin in the sinoatrial node and cause your heart to contract. Sometimes the sinoatrial node is also referred to as your heart's natural pacemaker, since it keeps the heart rate constant and consistent. The impulses then travel to the atrioventricular node, where the signal is checked and then sent through the ventricles, which causes them to contract. Your heart rate can change based upon external conditions such as diet, exercise, stress, or even hormonal factors.
Alrighty. Wow. Not an Academy Award winning video by any, but very informative. I like it. Alrighty, so back to coronary artery disease or atherosclerosis. It's caused, as the gentleman said, by the cholesterol buildup or plaque, which builds up in the arteries and supply blood to the heart. This is the leading cause of heart attacks due to the decrease in blood flow. How it works in men and women is a bit different, and I'll talk about that later. The disease develops over years. This is not something that you're going to get overnight. It's caused by a number of things like eating fatty foods and smoking, high cholesterol, high blood pressure, kidney disease, or even that family history. All right, so this just is another little picture of the anatomy of the heart attack. When you do get that blocked blood flow, you can see where it is in the middle of the heart, and anything beneath that is not getting any blood or oxygen and is causing tissue damage or even tissue death. All right, so let's talk about some heart attack signs and symptoms that may be a little bit different in women. They may be lightheaded. They might have pain, discomfort, or numbness in their arms, back, jaw, neck, or even between the shoulders. Chest, again, they have that feeling of chest pain, pressure, fullness, or squeezing. And this is something that lasts longer than a few minutes. And sometimes women will say that it comes and goes. Skin, they may show that signs of cold sweats. They may have trouble breathing or shortness of breath. They might have an upset stomach or an urge to throw up, or that feeling of heartburn. Some women feel very tired, sometimes for days or weeks before a heart attack, and may also often have heartburn, a cough, heart flutters, or even lose their appetite. So, what women think a heart attack feels like is that chest pain that we've all heard of, through years and years and years in the movies, in science, you name it. But what they actually report as heart attack symptoms are a bit different. They report the extreme fatigue, the sleep disturbance, the neck, back, or jaw pain, indigestion, and flu-like symptoms, and even anxiety. All right. I wanted to tell a little bit of a story about a college student by the name of Christy, whose mother suffered a heart attack at home one morning in the early 2000s. Despite CPR and 911 calls, her mom passed away, and this really had major changes in life of the 19-year-old who just lost her mom. And she said that she had all the signs and symptoms, but they just didn't know those were signs and symptoms of heart disease. So for 6 months, she couldn't sleep, had extreme exhaustion, and what she described as indigestion. None of them were aware that that was a sign of heart disease at that time. So Christy's mom's pain was simply attributed as heartburn, and she was treated as such. The night before she died, she went to the emergency room. She was kind of convinced that this was more than indigestion, but the doctor told her that it was heartburn, gave her something to numb the pain, sent her home, and she died the next morning of a massive heart attack. So this 19-year-old has now become a very passionate speaker about her mom's disease. And she says the experience changed me. She was wanting to work with animals her whole life, and now she's really ready to work in the healthcare field and educate women, especially on heart health. So I think that's pretty incredible. Alrighty, women with stable angina. This is treatment differences. Not always bad, but I think we need to see some of the differences. With stable angina, which is the chest pain, have been less likely to have an exercise stress test than men. Cholesterol lowering medications and blood thinners were used significantly less frequently in women, both at the initial visit and 1 year after their heart attack or heart disease diagnosis. And it seems like only the women who've been most severely affected underwent aggressive testing and treatment for their heart disease symptoms. Now, disease differences. In a review of angiogram studies, it's shown that women have less stenosis or narrowing of the arteries that limits the flow of blood in their cardiac arteries. Even without their narrowing of the arteries, their symptoms seem to worsen. And many of the women who had stress test abnormalities suggested that their heart disease might be the result of microvascular disease or endothelial dysfunction. And microvascular disease, I'm not just going to leave you hanging on that one, is the smaller arteries that are in the heart, in the coronary arteries. And not only that, as women, we have smaller arteries to begin with, so sometimes it is harder to detect. Endothelial dysfunction. Means that basically the blood vessels have a harder time contracting and expanding. Now, two other things. Plaque erosion is twice as likely to be the factor causing a heart attack, whereas in men, they tend to have a plaque rupture. Okay, this was a tough one for me to get my head around, so I can imagine it's kind of dizzying. But plaque rupture is when you get that, you see that classic little picture of cholesterol breaking off and causing a heart attack. The plaque erosion is when instead of just breaking off a chunk, a little bit of it sloughs off and picks up debris on the way, like white blood cells, red blood cells, and more likely causes a clot than just a hard blockage like the rupture would. Women have similar amounts of plaque as men, but this is interesting, whereas you'll see the blood vessels in men, they get narrower and narrower and narrower with the plaque that builds up. However, with women, instead of it making it narrow, it grows outwards. So it doesn't really affect the interior of the blood vessel. So risk factors for heart disease, two types, those that you can control and those that you can't control. So first we'll talk about those you can't control, like gender, family history of early heart disease, a history of preeclampsia or high blood pressure during pregnancy, race. Women of African American or Hispanic origin are more likely to develop heart disease. Age, after 55, one of the benefits, of getting older, heart disease becomes more of a risk. And they think it's because estrogen levels drop and increase the woman's risk for heart disease. But they also have noticed that women who've gone through menopause early, either naturally or through hysterectomy, have a greater risk, twice of the risk actually, of heart disease for women at the same age. Now, risk factors that you can control. This is the one that makes me feel a little bit better. High blood pressure, high cholesterol, and in women, particularly high triglycerides and low HDL. Diabetes or prediabetes, being physically inactive, smoking, and being overweight or obese. And apple shape is a higher factor in women. We'll talk a little bit about this more. Again, differences in risk factors between men and women. Smoking and hypertension are more common risk factors for men because more men smoke and more men have hypertension. Now, elevated triglycerides and low levels of HDL, the good cholesterol, are more prominent potent factors for heart disease in women. Mortality rates from heart disease are nearly 3 times higher in diabetic women than in diabetic men. And abdominal obesity in women definitely causes an increased risk for coronary artery disease. Low estrogen levels appear to be a risk factor. And this I thought was quite interesting. Hormone replacement therapy or estrogen replacement therapy does not seem to reduce the risk for heart disease. So it has to be your own body's own natural estrogen. Metabolic syndrome, which includes diabetes, hypertension, and elevated lipid levels, causes a greater risk for death and major cardiovascular events, independent of body mass. So it doesn't matter if you're thick, thin, tall, short, you have an equal risk. And this is the American Heart Association's Life's Simple 7 Steps. So there is hope for us out there, ladies. There are things that we can do to reduce our risk for heart disease. We can get active, control our cholesterol, eat better, manage blood pressure, lose weight, reduce our blood sugar, and stop smoking. So, number 1, getting active. I love this picture. I can imagine my mom in this group of ladies. Daily physical activity definitely increases your length and quality of life. If you get at least 30 minutes of moderate physical activity every day, brisk walking is fine. 5 times a week, you can almost guarantee yourself a healthier and more satisfying life. And as a bonus, you're lowering your risk for heart disease, stroke, and diabetes. If you can't handle the 30 minutes of moderate physical activity at a time, break it down. Do 3 10-minute sessions a day or 10 3-minute sessions a day. And what to do? Start by learning the basics about fitness. And I really like this one too, because it's recommended that children get 60 minutes a day, every day of physical activity. So find ways to work out with your kids or grandkids to help ensure their heart health in addition to your own. All right, 2, control your cholesterol. When you control your cholesterol, you definitely give your arteries their best chance to remain clear of blockages. Cholesterol is a naturally occurring substance in our bodies that helps make cell membranes and helps produce some hormones. But indeed, when you have too much bad cholesterol, the LDL, it combines with white blood cells and can form plaques in your veins and arteries. And these blockages are the ones that lead to heart disease and stroke. So what do? Lower your cholesterol by eating a diet that decreases saturated fats. And that kind of runs right into step 3, eat better. Healthy foods are the ones that fuel our bodies. They make new cells, create energy, and help fight disease. So don't skip out on your veggies, your fruits, your fiber-rich whole grains, lean meats. Otherwise, your body is missing basic building blocks for life. So what do? Track what you eat with a food diary if you feel like you need to. Eat fruits and vegetables, unrefined fiber, rich whole grain foods. Eat fish twice a week at least. Cut back on added sugars and saturated fats. I always tell folks that you should shop the outside of the grocery store, where you want to go through the produce section, the meat section, the dairy section, before you start going down the aisles where most of the foods have the added sugars, the added fat, the added sodium. So, manage your blood pressure. Since this is such a risk factor for heart disease and stroke, when your blood pressure is in a healthy range, you reduce the Let's back that up. You reduce the strain on your heart, your arteries, and your kidneys. High blood pressure, on the other hand, means that the blood is flowing through your blood vessels at such a force that it causes little micro tears in the blood vessel. And as a result, the body needs to go into healing mode to repair these tears with scar tissue, which then accumulates and traps plaque and white blood cells, which form into blockages, blood clots, and hardened, weakened arteries. So, again, what to do? We're back to the diet again. This is kind of eat a healthy, heart-healthy diet, which includes reducing sodium, getting regular physical activity, and maintaining a healthy weight. Limit alcohol and avoid tobacco smoke. When I first read that, for some reason, I thought it said avoid avocados, which I thought was kind of odd. But now then, blood pressure. Within the past year, the blood pressure categories have changed. You used to have normal blood pressure up to 139/89. No longer. Normal is now considered by the American Heart Association and the American College of Cardiologists as less than 120 and less than 80. You would be considered actually to have high blood pressure if your systolic or upper number reaches 130 or is over 80. And then, of course, you've got stage 2 high blood pressure. And what is now considered a hypertensive crisis is any systolic blood pressure reading over 180 and or the lower number reading higher than 120. All right. Manage blood pressure. We think we already touched base on this. Oh, I went the wrong way. Lose weight. If you have too much fat, especially around the waistline, you're at higher risk for many health problems, including heart disease, cholesterol, and diabetes. So, if you're overweight, you can reduce your risk, obviously, by losing some weight. Even as few as 5 to 10 pounds really incredibly drops your blood pressure. So that's a wonderful thing to do. Calculate your body mass index, which is basically your height and weight, to help you determine if you need to lose weight. A healthy BMI is below 20 to 25. Talk to your healthcare provider about a weight loss plan that would be safe for you and one that you can stick with as well. Reducing your blood sugar, of course, and most of the food we eat is turned into sugar or glucose that our bodies use for energy. Your body produces a hormone called insulin. Insulin is the key to getting the sugar from your bloodstream into the cells that need it. So when you check your fasting blood sugar, if it's under 100, you're in a healthy range. And if not, your results could indicate diabetes or prediabetes. So even though it's treatable and you can live a pretty healthy life, even under control, it greatly increases the risk for heart disease. All right. So the following tips can help you reduce your sugar. Reduce sugar consumption, including soda, candy, sugary desserts. Again, get regular physical activity. Moderate intensity aerobic physical activity definitely helps your body respond to insulin. And take your medications or your insulin if it's prescribed for you. Last but not least, in the simple 7, stop smoking. Cigarette smokers are at higher risk for developing cardiovascular disease. If you do smoke, quitting is the best thing you can do for your health. It damages your entire circulatory system and increases your risk for coronary heart disease. Hardened arteries, aneurysm, blood clots. It's like a line of tumbling dominoes. One risk creates the other. blood clots and hardened arteries increase your risk for a heart attack, stroke, peripheral arterial disease. So smoking can reduce your good cholesterol and your lung capacity, making it a heck of a lot harder to get the physical activity you need to remain healthy. So here we go. 1 year after quitting smoking, the risk for a heart attack is cut in half. 15 years after quitting smoking, the risk of a heart attack is reduced to that of a non-smoker. And if you smoke and you're ready to quit, do whatever it takes to get you to stop smoking. It's definitely worth it. See your healthcare provider. They have a number of things that can help you reduce your cravings for tobacco. American Heart Association has a quit smoking website, and the state of Maine has the quitlink.com for more tools and resources too. So we'd be happy to help you quit smoking any way we can. All right, the last, and I think should be the simple 8, because I think number 8 should be know your numbers. Total cholesterol should be under 200. LDL, or your bad cholesterol, optimally should be under 100. Really want it to be under 130 for sure. HDL, or your good cholesterol, should be 50 or higher. Now, the reason for the HDL, that we want that to be high, is it acts as a scavenger in the bloodstream, seeking out LDL, hooking onto it and taking it back to the liver where it can be reused and recycled, and thus not creating as much hardening or plaque buildup in the arteries. Okay. Blood pressure, and we talked about that, should be under 120/80. Fasting glucose under 100. Your body mass index, or BMI, should be under 25. And your waist circumference should be under 35 inches. And exercise, again, a minimum of 30 minutes most days, if not all days of the week. So, for more information on all of this, you can always go to the Go Red for Women site. It's the American Heart Association's campaign to educate women about reducing their risks for heart disease. It has a lot of excellent information and a lot of different programs. The little red dress is the symbol for reducing your risk for heart disease. And join us in March for our presentation from Yasmin King, as she gives us a rousing story about the prevention of colon cancer. We've been having a good time trying to find a name for her presentation. So if you have any suggestions, let us know. All right, here's some references and some resources. And I'd like to thank Harrington Family Health Center again for giving me the opportunity to do today's presentation. We're accepting new patients here. We're trying to improve our access to patients in the community. We stay open till 7 o'clock on Thursday evenings, as well as we just recently started staying open from 12 to 1 as well to increase access there too. So thanks again for coming. Thanks to Marty Russ for this cartoon, which I really like. So we got you something, the lungs say, and the heart says, I love it. I'm going to share it with everyone. So again, thanks for coming.
Very nice.